Hello everyone, I'm Dr. Divya Sharma, a dermatologist practicing in the heart of city, Whitefield, Bangalore. I have a special interest in trichology, pediatric dermatology and cosmetology, and I sincerely believe it is very important for our patients to know about their condition, how it happens, what can be done in order to amalgamate them into the process of decision making. It becomes very easy for you to decide when you know where we falter, what can be done, what cannot be undone. So in this series of videos, we'll be talking about the common myths, common concerns and common questions regarding hair fall, which is like the new epidemic. We have to understand that each hair follicle is irrigated by your own blood vessel. So whatever is happening inside you is reflected on by the hair. The most common cause these days, I perhaps feel, is an increase in nutritional deficiencies. Though all of us spend a lot of money on the food and there is a greater rise of people eating out, we do see maximum patients suffering from nutritional deficiency, iron deficiency, lacking in vitamin B12, vitamin D3, with lack of sun exposure and a sedentary lifestyle. Most of the patients are found to be deficient in these micronutrients. There is also a rise in obesity. So obesity is a cause of hormonal imbalance, which indirectly causes thinning of hair and loss of hair over a long period of time. Erratic lifestyles, late working hours lead to a decrease in the natural hormone known as melatonin. So melatonin is no longer considered as a sleep hormone. It also influences your hair growth. So if you're sleeping late night, you're working in night shifts, the lack of melatonin is going to affect the growth of your hair. There is also a rise in autoimmune diseases like thyroid, which leads to thinning of hair, increased shedding of hair. So I think with the growing sedentary lifestyle, with the diet which is lacking in iron and protein, Western diet which contains more refined sugars and processed foods. So in summary, a high carbohydrate diet is against hair growth, whereas a low carbohydrate and high protein diet with an active lifestyle is the essential key for growing healthy hair. Yes, I believe, as I said earlier, whatever is inside you is going to be reflected outside, and hair is essentially made up of peptides which are derived from protein. So it is very important for us to have a diet which is rich in protein, as it forms the backbone of hair. Your diet should be very rich in iron, micronutrients, selenium, copper, the essential vitamins like vitamin B12 or vitamin D3. If you lack in vitamin D3, it is going to cause increased shedding of hair. And it's also important that certain key practices, need to be changed. Certain changes need to be made in the daily lifestyle. Like we definitely need to cut down on our tea and coffee intake. Tea decreases iron absorption, leading to hair fall. So nutrition, especially a iron and protein rich diet, is the fundamental thing we need to ensure to make sure that our scalp and our hair is healthy. Stress directly and indirectly impacts the hair growth. A stressful lifestyle leads to erratic eating hours, a decreased absorption, and it definitely impacts your digestion. So if you're stress prone, you're also prone for developing nutritional deficiencies. Number two, if you're working late night hours, it's going to impact your body's circadian rhythm. We start lacking melatonin, which starts affecting the growth cycle of the hair. Stress also leads to increased motility. So it's not important that if you're eating well, despite being stressed, you're absorbing the nutrients as well. So it's important for you to be calm and relaxed in order to have a healthy hair and scalp. Hair, just like skin, requires a daily maintenance. We are constantly regaining and losing hair. If you go back by the life cycle of the hair, we gain hair every 2 to 3 years. It stays in the follicle for just a month. It retires for 3 months. It sheds and a new hair forms. So if you change, if your inner nutrition, your inner metabolism changes, hair is bound to change as well. So a non-sedentary and active lifestyle coupled with a good nutrition is the only permanent solution to have good and healthy hair. I would summarize it as first, diet. It is very important to focus on iron and protein in your diet. Avoid carbohydrates, processed foods, refined sugars to as much extent as possible. Number 2, smoking, alcohol and recreational drugs are a big no-no. Number 3, sleep on time. Remember, your circadian rhythm or melatonin drives both your skin and hair. Number 4, it is very important for you to do your daily workout. We cannot give you a magical potion until you are up and running.
To book an appointment with a cosmetologist or a dermatologist in your area, please visit www.skinandhairacademy.in.